Hey everyone, it's Michael here at Home Health Success Academy and 10xpatientreferrals.com. What you're going to be watching here is an excerpt coming from our webinar on how we actually taught a lot of our current members at 10xpatientreferrals.com how to be able to take advantage of the current COVID-19 epidemic and how to be able to double or even triple your referrals by taking advantage of the current state that's happening right now. So just to let you guys know, you're going to be watching an excerpt coming from that 2.5-hour webinar that we actually created. But at the very same time, if you enjoyed this quick excerpt, you're going to be able to actually watch the full webinar. All you have to do is click the link down below. And at the very same time as watch the webinar all the way through, because it's going to be on for a very limited time, then we just pull it out. But we're going to be offering you guys a lot of additional bonuses that you should take advantage of now. So enjoy the video and make sure you click the link down below after you watch this video. So one thing you guys need to do is you need to have strategies, have tactics. And part of marketing is your branding your company. So, I'm going to share with you guys what we did, right? So I was in the Philippines a few months ago, right? And so in the Philippines, and this was before the whole COVID thing. This was like around November of 2019. And a lot of people there wear face masks. They wear face masks. And why do they wear face masks? Well, because, of the dust and everything, right? So a lot of people wore face masks, not just because there was some disease going on around that time, but just because of the dust. But at the very same time, nowadays, they're suggesting to us to do what? To actually wear face masks at this very moment. It's suggested by the CDC, suggested by the president, suggested by the governors to have face masks, have something of a barrier between you guys. So having that mindset and having that thinking before even there was that rule to wear a face mask outside, and not all states are requiring this, but if you guys ever look back in previous history, the Spanish flu, it became the law that people could not go outside unless they wore face masks. So knowing this, we started had an idea and say, hey, let's brand this whole thing, right? You guys gave away what? Brochures. You guys gave away pens. You guys gave away what? Mugs, all these different things. So what we ended up doing is that we contacted a local person that we knew who knows how to sew. And we said, hey, we want something done basic like this, okay? And then what we did was we reached out to some screen printers, people that did screen printing. And so what we did is we created, within 1 week, we had 1,500 masks. So let me share with you guys what we did for a mask. And this is something for branding, right? So if I put this on right now at this very moment, now we have our face mask, right? So for one of our home care companies, we were able to put this, make a face mask with logo in it as well. We gave away 1,500 of them, right? And this was for us to be able to market our non-medical home care companies. And what we did was we started handing these things out in a senior community area. And we were giving 2 of these masks per household. So we gave in 1 week over 1,500 of these masks. And once we gave out 1,500, we already had more being made as well. And what's funny is that people in our areas, in the 2 different states where we had our non-medical home care company, were wearing these face masks. And at the very same time as, guess what? It was branding our company. And then people were asking, hey, where did you get that face mask? Oh, I got it from this company. And when we gave the face mask, attached was a business card, a brochure of what we do, some information about COVID-19, how to prevent certain things. And this allowed us to brand us. These things right here cost us to make less than $1.50 made. Less than $1.50 to be made. One of these face masks, less than $1.50 to be made. But guess what? 1,500 within that first week of us handing those out for free, we were able to get four non-medical, full-time, 50 hours a week, right? Non-medical home care clients. What's funny is that it eventually then got us more patients for our home health, our medical part, because people actually needed services. So they actually asked us to provide the services for them when they reached out to their physicians. So what can you guys do at this very moment to be able to make you guys stand out? Are you guys making these things, right? Making sure that not just, providing these masks, but providing educational-based marketing materials. So this is what we call branding. And you need to understand that this is what's going to be able to get you guys. And this is the funny part, is by the second week, we had over 3,000 of these masks being given out all throughout. And it then generated us 27 non-medical home care clients the second week. That right there is pretty crazy. So imagine that you're branding your company. People are wearing this. People are knowing who you are. Now, just to let you guys know, our first batch did not have our phone number, right? That was a mistake that we actually made. We didn't put the phone number. They did have the phone number, however, because we gave them our business card. So that was perfectly fine. But our second and our third batches that we were making, then we made sure our phone number was there. Because right now, people are walking around with our masks, our company, and our phone number there. And they're branding us. They're advertising for us. A lot of people can say, well, Michael, that's kind of messed up that you're using that situation. No, guess what, guys? A lot of people give away t-shirts with their information in there. We're doing the same exact thing. Our goal here is to give these things, to educate. It's not our job to try to get referrals. The goal here is to educate people, provide value, and then eventually see what we can do. Eventually, what we were doing is all our patients for our medical home health agencies are now getting these as well. They get 2 of these each week, right? Each week for the next few weeks, they get 2 of these, a week when the nurse visits them, okay? And this allows us to be able to have some form of a barrier between us. If they actually decide to go out, which we do recommend them to stay at home, especially people over the age of 65, is probably some of the highest rates of deaths right now in this whole system. So we want to be able to kind of slow that down a little bit. So what are you guys doing to brand your company? What are you guys doing that makes you guys stand out in the community? Think about that, right? Always understand, in marketing, in sales, our first goal is to never get a client, right? Is not to get that client, not to get that referral, but to educate. And if we can educate, that's going to eventually lead us to getting new clients and getting us new referral sources. Okay, so we're currently right now in facing the problem number 2, right? Not being able to gain new referral sources. Now on on part 2, or the second portion of this video series on COVID-19 marketing tactics, we're going to be talking about, how to actually take advantage of the COVID-19 restrictions. But so far right now, we're just in the first part of this video series where we're talking about the 5 different problems, right? So on the second portion of this whole video series, I'm going to go further into showing you guys how to be able to make yourself, as a marketer, as a company, stand out from the noise of other agencies, and how to add more value so that you will become the chosen and the preferred provider to be able to get those referrals. Okay, so please keep on, staying through this whole thing. I know you're gonna say, well, Michael, how long is this whole training? Look, I'm trying to give you guys as much information as possible to become successful. So I shared with you guys several things that we're doing right now that makes us stand out, that